because it's absolutely key, is remembering our humanity, remembering that we aren't alone.
In today's conversation, we are exploring self-compassion and why this skill matters to anyone who's navigating trauma, healing, personal growth. Welcome to Trauma Rewired. I'm your co-host, Elizabeth Kristoff, founder of brainbase.com, an online community where we use applied neurology and somatics for personal growth, resilience, and behavior change. And I'm also the founder of the Neurosomatic Intelligence Coaching Certification.
And I'm your co-host, Jennifer Wallace. I'm a neurosomatic psychedelic preparation and integration facilitator, and I bring your nervous system into your peak somatic experiences.
With Dr. Kristin Neff, the pioneering researcher who introduced self-compassion into psychology, we'll explore how self-compassion transforms our relationship to pain, emotional health, resilience, and post-traumatic growth.
These are the same elements that go into compassion for others, which we're more familiar with. The first is mindfulness. Perhaps not a mistake that I learned about self-compassion while learning mindfulness. But mindfulness is the ability to turn toward and notice and kind of acknowledge that suffering or pain is present. And it's hard to do that because normally when there's some sort of threat or something that's uncomfortable, we do two things. Either we want to run away and pretend it's not there, like that homeless person on the street. I just don't see them. Right. And so if we don't see our own pain, if we just like stiff upper lip it, how can we respond kindly to ourselves? So we need to be aware of it, but in a balanced way. If we're lost in what we're going through, it'd be like, sometimes you call a friend and you just want them to listen and they talk right over you. Sometimes we do that to ourselves. We kind of get lost in our stress and our pain so that we can't see clearly. So we need mindful space just to say, okay, this is happening. This hurts, this is difficult, then that kind of clears the space for what do I do about it next. Okay, so that's the foundation. And then we need to respond with warmth and kindness and support. In the field of psychology, actually, compassion isn't defined as an emotion, it's defined as a motivation. In particular, the motivation to help, to alleviate suffering. So we need to have that motivation toward ourselves. What can I do? What do I need right now? How can I help? How can I be there for myself? And so that's the warmth quality of self-compassion. And then third, and this is key, and by the way, when I was first formulating my model, I didn't realize this element was there, but I'm so glad I put it in there because it's absolutely key, is remembering our humanity. Remembering that we aren't alone. In our society, we kind of think we're supposed to be perfect, and we kind of imagine that everyone else in the world is living a normal, perfect life, and it's just me who's had this horrible experience, or just me who's had that failure, and we feel isolated by our suffering, or for our trauma, or whatever happens in our life. Even if what happens to us is unusual, part of being human is unusual things happen. Like there's nothing wrong with us or abnormal about us when difficulty happens. And yet we kind of think it does. So remembering our humanity in those moments, that this is part of the human experience. It may be uncomfortable, it may be horrific, but doesn't make you abnormal or weird or strange because this is happening. What happens when you remember you aren't alone is then you feel connected to other people. You don't feel so isolated and cut off. And as human beings, when we feel like we're cut off from the group, that exacerbates the threat because then we're left to the wolves. So remembering that we're part of this larger whole helps us feel safe.
Yeah. Well, amazing. Like I've been in researching and like listening to you for this podcast. And when I reflect on my own experience and through complex trauma and the way that my F responses are so wired, I really forgot my humanity a lot because I always internalized my mistakes as like, and then the shame would take over me, and it was so bad. And then when you talk about in your research, you draw this distinction between self-compassion and self-esteem, and I think this is really important to flesh out for people because self-esteem is often based on achievement and performance and comparison.
Yes.
While self-compassion is unconditional, and and when I think about all of this, and I think, gosh, no wonder because like I used to operate from such a low self-esteem because I used to not really fit in very well with the matrix really, and like going against the grain, and like I really pushed so hard, and I I just couldn't maintain the status quo.
Yeah.
And so I really loved listening to this idea and what you talk about with self-esteem. I'd love to explore that a little bit deeper, because also I want to say that I've also heard you say that the Latin for compassion is to suffer with.
Yes.
So when you said it's an actionable term, it's in the very root of the word, is that it's a word of action.
Yes, no, absolutely. I mean, so people say, why are you all so focused on pain and suffering, Kristen? I'm like, well, there's love, there's happiness, there's lots of good stuff in the world, but my little niche is how we're suffering, because that is in the word. And that's the most difficult thing to be with. And that's what takes us down in these negative spirals. Something difficult happens, we blame ourselves, we judge ourselves, and then down we go. So how we show up for ourselves is so key. And the reason I compared it to self-esteem, actually my first paper was called Self-Compassion, a Healthier Alternative to Self-Esteem, was because I'd actually done a postdoc, 2 years of postdoctoral study with a leading self-esteem researcher. So self-esteem, again, the root of the word, an estimation of worth. We evaluate, am I a worthy person or am I not a worthy person? And usually it's based on social comparison. Get this, to have self-esteem, we all have to be special and above average. Think about that. It's logically impossible for us all to be above average, at all times. But if I said,
All the
hey,
time.
this podcast is average, you'd be like, oh. If you say, Kristen, your work is average, self-esteem is predicated on a logical impossibility, which is we have to be better than others. It's on social comparison. Because even if maybe I'm better than these people, but that person over there, look at Brene Brown or someone like that, right? There's always someone more successful who's getting more fame, more accolades. So it's this actually leads to division, because we're comparing ourselves to others. We don't feel connected to them. We're like almost in competition with them. That's the problem. Some people become narcissistic, like they can't let in any possible acknowledgement of flaws because it's such a threat to their self-esteem. But the biggest problem with self-esteem is that it's contingent. It depends. We have it when we succeed, or when other people like us, or we set our goals. But what happens when we fail? Or other people reject us, or things go wrong, then it deserts us. So I like to say it's a fair weather friend. It's there for us in the good times, but it deserts us when we need it most, and that's when we've fallen flat on our face. And if you think about compassion, our sense of self-worth comes simply from being a flawed human being. That's a box that can always be checked, especially, it's like a good, stable friend. It picks us up when we're down. When a baby's born, they're intrinsically worthy of care and compassion. They don't have to earn it. It just comes with their humanity. And this right to human compassion goes with us our entire life.
Make sure to subscribe to this episode on our audio platforms, or hit the little bell on YouTube to subscribe to our channel so that you never miss an episode, because we have lots of exciting conversations coming up, breaking down the science and the trauma of emotional health and nervous system resilience.